Thanks for being here. In video 2, we'll share our perinatal mental health toolkit with you. So first, you may feel like much is out of your control. The medical care, the timing, the outcomes. In this video, we will share our mental health toolkit based on cognitive behavioral therapy techniques and daily disciplines we have found to be helpful in our experience. Before walking through the tools we have for you, it's important to note 2 things.
First, we highly encourage one-on-one support in both peer and professional contexts to meet you exactly where you are. No 2 situations are the same. Carry Me Health exists to offer the many facets of support fetal care parents deserve, including personalized resources, live coaching, peer support, and access to licensed mental health.
Second, we believe it's helpful to level set on some common symptoms we see tied to fetal care. So first, stress. Stress can show up physically as headaches, insomnia, or heart palpitations. Chronic stress can increase risk in preterm labor, low birth weight, and preeclampsia. Although with a fetal concern, some of these risks may already be present. Emotional signs can include depression and anxiety, which we will describe next. High stress during pregnancy is one of the strongest predictors for developing clinical depression after birth.
Depression may look like exhaustion, irritability, sleep changes, appetite changes, or feeling disconnected.
Anxiety might look like constant worry, difficult concentration, or trouble relaxing between appointments.
Grief in a high-risk pregnancy can involve intense emotional distress, from fear of loss, trauma from the diagnosis, or previous loss. Symptoms can include severe anxiety, depression, anger, guilt, hopelessness, or emotional numbness.
So these symptoms are very common when faced with a fetal concern. They deserve support that truly understands what you're going through. This is more nuanced than maternal mental health or even perinatal mental health for the general population. Carry Me Health is built specifically for fetal care.
Now let's walk through recommended tools for parents. And again, this toolkit is for you if you just received a diagnosis, if you're making care decisions, if you're preparing for birth, if you're postpartum, or if you're grieving a loss.
A mental health toolkit should be simple and easily accessible, something you remember and can use anytime, anywhere. What we see helping most parents are simple, repeatable habits that are proven to regulate the nervous system. They are powerful in moving through difficult circumstances. Your toolkit should include a few go-to individuals and personal skills that help you to connect, reflect, gain perspective, relieve stress, and find purpose each day.
Our mental health toolkit is designed for families on the go to guide you in a daily or weekly routine that fosters hope and action for any stage of fetal care. So first in the toolkit is to find your inner circle. Invite 1 or 2 people into your story. This might be your partner or a trusted family member or friend. Someone likely already comes to mind. They've shown up for you before. Ask them to check in, ask them to ask questions, ask them to walk through this with you. It may feel vulnerable, but these hand-selected people will likely rise to the occasion. They can't change your circumstances. They may not say everything perfectly, but they do want to support you now and long term. Encourage simple questions like, how are you right now? Or how can I help? These questions help you say out loud what you're feeling. They can help with meals, transportation, and childcare so that you can focus on your baby's care. Your inner circle can help to track questions, appointment times, and details for you. They can even join you at key appointments and take notes so that you can focus on listening.
Second, ask about perinatal palliative care. If you are navigating fetal care, you likely have a team, an MFM or OB, nurses, pediatricians, NICU, surgery, and possibly a social worker coordinating. If perinatal palliative care is not already involved, ask if they can join your care team, both before and after birth. Palliative care happens alongside medical treatment. It's not the same as end-of-life care. This helps ensure your care aligns with your goals and your family's values. In addition, Carry Me Health is poised and ready to assist in this capacity.
Third in the toolkit is to keep a gratitude journal. I know gratitude may feel impossible right now, but stay with me. This is a time when many of us ask why or why me. In the face of trauma or heartbreak, gratitude can be a lifeline. Research shows that gratitude practices can improve mood and reduce symptoms of depression and anxiety. Smiling also has a real psychological impact. It can lower stress hormones and boost mood, even helping you recover faster. So each day, write down 1 to 3 small things you're grateful for. Over time, this practice can gently lift your perspective. Save your journal to look back on and remember moments across your journey. We hope and believe these will be moments that will help you smile.
Fourth in the toolkit is set an intention or pray. Each day has enough worries of its own. Setting an intention or saying a prayer can help you focus on today. It can help you move from survival mode into strength, even just for today.
Fifth, take short breaks. Even 30 seconds can help to reset your nervous system. If you're feeling overwhelmed by medical information, by balancing life and work, by caring for your family, by the holidays, or even by your calendar, take a quick break. Step outside, look up, walk down the hall. Take a 30-second field trip. That could alter the course of your day.
Sixth, practice deep breathing. Slow breathing can lower your heart rate and reduce stress hormones. With eyes open or closed, take 5 slow, deep breaths. Draw your attention to your breath or your body and inhale for 4 seconds, hold for 2. Exhale for 6.
All right, we just covered 6 tools to keep in your mental health toolkit as a parent navigating fetal care. That was a lot. Rewind and choose one exercise that feels doable today. Next, we will talk in video 3 about navigating key relationships, beginning with your partner.